Welcome to the Well Health and Chiropractic family. If you're watching this video, you have chosen a corrective chiropractic plan, and I couldn't be more excited for you. So today, what I want to do is I want to show you three things. Number one is the in-office procedures. Number two is I want to talk through the home care kit. What do you need to do at home to move and mold and restabilize your ligaments? And then number three is I want to give you some tips and tools of how you can incorporate the other wellness factors, nutrition, detox, exercise, so that we can get you well on all angles. Listen, I'm Dr. Ben. Welcome. Glad to have you. As soon as you walk in here, there's a 4-step process that's the secret sauce to the corrective adjustment. And what we're going to do is step number one is we're going to loosen the spine. This is actually called, as a form of active decompression called imbibition. A lot of people don't realize that the discs in between your spine, your bones, those have no blood supply. So the only way that the nutrition gets sucked into that disc is you actually have to pump the disc. And what we're doing here is trying to catch all corners of the disc with motion. So we call this our yes, no's, and maybes. Let me show you how it works. And we're gonna do 10 of each, by the way. So a yes looks like this. We're gonna tuck our chin to our chest all the way down. We're gonna look all the way up towards the ceiling. Tuck our chin all the way down to the floor and all the way up towards the ceiling. Now we're not trying to strain our spine. What we're trying to do is get a nice good stretch in here, up and back. Now a yes is down and up. That's one. You're gonna do 10 of those. The second thing we're gonna do is a no. And that's gonna be, we're gonna put our hands on the side of our legs and we're gonna look as far as we can behind us. Now, it's very important that when we put our hands on our legs, we're not trying to just crank our low backs here and tweak our low backs. What we're trying to do is that's going to give us a good way to get a good stretch, looking over our shoulders both directions. Okay? By the way, this is going to help you back out of their driveway better and see behind you. Okay? And what this again, a left and a right equals 1 repetition. So we're going to do 10 of the no's. The final exercise here is going to be our maybes, and that's going to be side to side. The trick here is we're going to take our left ear, put it in our left pocket, right ear, right pocket. And we're going to be cupping our spine each direction. We're not trying to do this super fast. We're going to hold just a little bit at the end. So 1 rep is a left and a right. We're going to do 10 yeses, 10 nos, and 10 maybes, and that's loosening the spine. All right, come on with me. The second thing we're going to do is what we call neck traction. What neck traction does is heats up the discs in the neck. Now, this is a repetitive cervical traction. This is not about stretching your neck as hard as you can. I'm going to show you a few poor ways to do it. I'm going to show you the right way to do it. What we're going to do is we're going to line this up. This bar right here is going to go to about the base of your chin. And then we're going to take this rope and we're going to shove it real deep into that cleat. We don't want it to just be real light or it'll slip out. We're going to shove it real deep into that cleat. So this bar is going to be right here. Now it's really important. The curved part goes behind the neck. And then this part goes under your chin. We take 2 fingers. We hold on to this bar. And now I'm going to squat down. My feet are shoulder width apart. I'm going to squat down. Now I'm going to stretch and hold it for 1.5 seconds. Down and up. Down and up. Down and up. Down and up. Now we're going to do this 50 times in the office normally. Now on day 1, I'm going to recommend we do this about 20 to 30 times. Work your way up to 50 times. If you've never done this before and you do it 50 times, you might find that this is a little bit uncomfortable, and that's okay. Now it's really important, by the way, what we don't want to see, I'm just going to point this out, is we don't want to see, there's 2 things that we see. That we call it the chokers and the hangers. We don't want to do that. The chokers are going to do a couple different ways. They're going to be like just hanging themselves over there, choking themselves, or they're going to put this round part, believe it or not, underneath of your chin like this. If you feel like you're going to choke and die, you got it wrong. So please don't do it that way. I joke when I say that, but it happens. People like choke themselves out. Don't do that. The other thing we do is we call the hangers. Those are the people, they're going to put this here, and then they're going to just flop backwards and flop backwards. That does not do anything for your spine. How we do this, one more time, this goes under your chin, we lock it into the wall, put this behind our neck, just like this, 2 fingers, stretch and up, stretch and up. Okay, super important, super easy, neck traction. We're gonna get to 50 reps of that every time you come into the office. All right, step 3, come on with me. Step 3 is the best part. That's where we get a world class chiropractic adjustment. So what we're going to do when we come into the room, it's really important is that we want to lay straight face down on the table. If we need to check in, but then we're going to lay face down on the table. Every once in a while, we'll have somebody that wants to sit on the table like this, and they're just so used to talking to a doctor every time they walk into an office. In our office, what we really want you to do is be face down to let your spine relax, okay? As a matter of fact, when you're laying down, those little muscles that we're trying to really relax for a great adjustment, they're relaxing. But if you're sitting up with good posture, waiting to talk to us, what's going to happen is your spine is not going to be relaxing. So just go ahead and lay down. If you have a question when we come in, just stop us and we'd be happy to answer your question. But we lay down. Again, when you're laying face down, it's real easy. We come onto the table, however you want to get there. We have these little pads for your arms. Put your arms here, put your face in the middle, and get comfy. If you want to fall asleep, we're good. I'll adjust you if you're asleep. Just kidding. Okay, another thing too, by the way, about the adjustment is we have a bunch of different ways to adjust your spine. Our doctors, we have things that we like to really specialize in, our little techniques. However, not everybody's built the same. You might be somebody who prefers an instrument adjustment, something like this, you don't really want somebody to put their hands on your neck and that's really uncomfortable for you. We would rather you just tell us, because we can go to another tool or an instrument or another technique. At Well, we verse ourselves in ways that you can have a very safe and comfortable adjustment, and we are all proficient in multiple different ways to adjust. So just make sure you tell us. No big deal. Okay, that is the third part, which is my favorite part, getting adjusted. The last part, we're not quite done. Come on with me. This part is the vibration part. So what we've essentially done is we've loosened up our spine, we've put our bones in the right position. Now it's time to strengthen them back down into place. What we're gonna do is we're stand on this vibe plate. You're gonna push 5 minutes. When we do this, you're gonna hear that vibration motor come on. You can hear me talking crazy. And that's gonna shake this thing. I'm gonna turn that off for this purposes. What this does is that's going to vibrate, and it actually vibrates at the resonant frequency of a disc. And specifically what it's gonna do is it's gonna strengthen those little muscles in your spine so that it's gonna solidify the adjustment and keeping it in the correct position. Now, unfortunately, some people are gonna have this bad habit. They're gonna pull out their cell phone and they're gonna be standing here with poor posture like this, and they're gonna solidify a poor posture. When you are on this, promise me that you're gonna stand here, either just like this with great posture, chin tucked back like this. You can watch the TV, you can put your hands up here, and we're gonna be here for 5 minutes in great posture. Whatever you do, don't be standing here with poor posture on your phone, because it's gonna beat up your spine. It's gonna negate some of that adjustment, okay? Excellent. Once you're done with that, you're done. But you're not quite done, because we still need to do the home care kit. So let me show you what that looks like. Come on with me. The home care kit is 2 pieces. We have a pelvic wedge and a neck wedge. So pelvic wedge and a neck wedge. You're gonna do this at home. You're gonna be laying face up in your bed. You can do this on the floor, you can do this in a bed. It doesn't matter if your bed is too soft, you need to go do it on the floor, because this part will sink into the floor. And what we do here, we'll do the neck first, is we're gonna take this, you're gonna see this cervical wedge has got a longer flat spot. That part is going to go down, it's gonna go towards your feet. Now, when you put this in, logic is going to tell you to put it in the middle of your neck. That's not what you're going to do. You're going to put this almost what feels like in where your shoulders are. And what that's going to do is throw your neck back and stretch your ligaments. You're going to like this part, okay? So when you put it here, I'm going to put this all the way in further than I would think. For any physiology nerds out there, this is going to be T1, your first thoracic vertebra. And what that's going to do is actually throw your neck all the way back. Oh, feels good already. And that is getting that ligament to go backwards. While you're doing this, we're gonna grab our pelvic wedge. And our pelvic wedge is gonna go on the side that the doctor tells you. Don't just do this on the side that hurts. Do this on the side that the doctor tells you. That's gonna be right at the belt line. You're gonna pull your hip up. You're gonna put that pelvic wedge tucked right under your hip. Keep your cervical wedge there and lay like this. And you're gonna lay like this for 5 to 10 minutes. Now, it's really important when you're laying like this. Some people, this is gonna hurt really bad. So if it hurts really bad, you're not a hero for fighting through the pain. Just if and when it hurts, just pull whichever piece hurts out and just work your way up to 7 to 10 minutes, okay? Some people may never get to 10 minutes, and that's okay. It's all really the condition of your ligaments. The better we are correcting your spine and loosening those ligaments with our adjustments and our corrective process, the easier that this is going to get for you. My goal for you would be able to throw your head all the way back, put a pelvic wedge in, and not to really just hurt you too bad. Sound good? All right, that's the home care kit. That's easy. How frequently do you do that? We're going to try to do that 5 to 7 days a week if we can. If you are just starting your corrective process, I'm going to recommend you do it every single day. Okay, every single day, and then eventually we're going to wean ourselves down a bit to where you're only doing it maybe 3 times a week. Okay, all right. So that is the procedure in the office. This is the home care kit. The last thing that I want to do is talk to you a little bit about some resources that are available to you as a patient here at Well. One of the best resources that you can have is going to be our website, fooduniversity.tv. What fooduniversity.tv is a free resource for you. It's an amazing nutrition workshop, all tucked in, a really cool video with recipes and hands-on tutorial of breakfast and lunch and dinner. And that's going to be a 45-minute free to you video. Now, we're loading fooduniversity.tv with other great resources, detox, some exercise programs as well. But make sure you tune in, fooduniversity.tv. It's completely free to you. Also, make sure that you plug in to Facebook, Instagram, and YouTube. We load those channels up with tons of videos that can help you in your wellness process. Now, finally, the last thing is it is super important. We totally believe that God gave us an amazing body that's designed to heal. We believe that if your nerves are pinched and cut, that your body cannot function the way that it's supposed to. When your vertebrae in the wrong position, your ligaments are going to break down. It's going to cause arthritis and pain and dysfunction. So who needs to be adjusted? Everybody needs to be adjusted. So we're going to encourage you along the way. Please, please, please think of us, refer friends in. You're going to see there are going to be times, usually 1 time per month, we do a free x-ray day. That's an opportunity for you to bring in anybody. They can have an opportunity to get a free x-ray just to see if it might be able to benefit them. Anyways, so I hope that you take advantage of that. But most importantly, I'm so glad that you're here. From the bottom of my heart, welcome to Well Health and Chiropractic. I cannot wait to hear your miracle story.